So how do you know if your astigmatism is normal or regular? Astigmatism is fairly common, but there is a next level up called irregular astigmatism. It can actually cause worse visual blur, can be difficult to correct the vision and difficult to treat, and can sometimes slip under the radar during an eye exam. So what is this and how do you know if you have it? Let's focus in. So a quick review of normal astigmatism. If you break the word astigmatism down, in Greek, a means without and stigma means point, meaning without point. Means that your eye doesn't focus light to a single point in the back of the eye. And this is due to the shape of the eye. For example, if you take an eye that does not have astigmatism, for example, the cornea, if you look at the clear dome on the front of the eye, this is where light focuses through to the back of the eye. An eye without astigmatism will have a nice spherical round shape to it. And this eye will focus light to a single point. Now, in astigmatism, you will tend to have one section of that cornea that is more bent than the other section of the cornea. So meaning that bent part of the eye will focus to a different point than the other bent. They're not focusing to a single point. So usually the visual symptoms that you get here are stretched out light. Sometimes people will notice this at nighttime when they're looking at street lights or headlights. Sometimes the lights will kind of have a starburst pattern or some streaks coming off the lights. Or sometimes when people are looking at letters or text, reading a book, they'll notice that there might be a little bit of a shadow or this faint double vision looking onto the text of the book. And that's because that light is being stretched out by one of the curves of the eye. And there are different causes to the astigmatism. Like I said, can be corneal astigmatism. You can also have lenticular astigmatism, where the crystalline lens inside of the eye can also have a different type of curvature to it, making it so the eye doesn't focus to a single point. The nice thing about regular astigmatism is that it can be corrected with glasses, contact lenses. LASIK can correct to pretty large amounts of astigmatism these days. You can have cataract surgery where they can put IOL implants that correct for astigmatism. So regular astigmatism these days can be corrected and that person can have really crisp vision. Now remember, these curves in astigmatism are usually close to being perpendicular to each other, about 90 degrees away. Now with irregular astigmatism, it can have multiple different curves to it and may not always follow a specific pattern. Those curves might not be 90 degrees away from each other, might not be perpendicular to each other. And so when you have that, the vision, like with astigmatism, you'll have a stretched out point. With irregular astigmatism, you can have a stretched out point and then multiple different stretched out points coming from the same point of light. And so your vision can kind of be a jumbled mess of blur. Now, irregular astigmatism can be caused by a few different things. One of them can be corneal scarring. If you have trauma to that cornea that caused a scar to it, it can cause an irregular surface to that cornea with different curves to it. Another one can be a surgery. If you have a surgery in or around the cornea, that can also cause an irregularity to the cornea, which can produce symptoms from irregular astigmatism. And then certain infections can actually cause that too. Sometimes people can get a herpetic or herpes infection on the surface of the cornea, which can cause scarring and irregularities that way as well. Now, probably easily one of the most common eye conditions that is linked with having irregular astigmatism is something called keratoconus. Keratoconus is a condition of the cornea where the cornea actually thins and bulges out almost into a cone shape. And if you can imagine, having that cone shape can actually cause multiple different curvatures and irregular astigmatism that can affect the vision. Now with keratoconus, and really anything that's causing irregular astigmatism, the amount of that curve and that bulge and how steep it is can vary from person to person. And so you might have some people that will have very mild blurring effects. Maybe they have ghosting, especially at nighttime, maybe a little difficulty focusing on certain things. And some people might have very, very severe blurring to the point that they really can't see anything. Another condition is called pellucid marginal degeneration, where you can have thinning of certain parts of the cornea that can cause irregularities. Another one is called Terran's marginal degeneration, where you'll have thinning on the outside edge of the cornea that can also cause these symptoms as well. And sometimes this actually can be caused by LASIK. If you are somebody that ended up starting with a very thin cornea and you got LASIK, sometimes that can actually cause extra thinning and bulging and movement to the cornea, whereas before it wouldn't have done that, and will cause irregular astigmatism because that corneal surface is no longer smooth. It has bulging and thinning around it. So as you can see, there are many different causes, and I'm just scratching the surface of the different types of conditions that can cause it. And this is what makes irregular astigmatism extra tricky, is usually correcting the vision can be difficult depending on how severe it is. A lot of times this person with irregular astigmatism, it can be very difficult to correct their vision with glasses. A lot of times these people actually need specialty types of contact lenses. And luckily we do live in an age where there are multiple options. There can be certain soft contact lenses that can be made for people with irregular astigmatism. Irregular corneas can still be tricky with soft contact lenses because they are kind of pliable and they move around a little bit. Usually people will do better with RGPs, or rigid gas permeable contact lenses. They're hard contact lenses because you can actually custom fit that hard contact over the different types of curves on the eye. And they actually do make RGPs that are specifically for keratoconus. There are also hybrid lenses where you have a center hard contact with a soft contact lens skirt. That can work really well and can sometimes be more comfortable. Or probably the one that's more popular are scleral lenses. This is a larger hard contact lens where the contact lens actually rests and is fitted on top of the sclera, the white part of the eye, and the contact then vaults over the cornea. Now because it vaults over the cornea, when you put that contact lens in, it's filled with solution, and so you have the contact lens solution in between the cornea and the contact lens, and it's almost like putting on an artificial eye or an artificial cornea for that eye. It provides a nice smooth curved surface for the light to be focused in, and actually can correct the vision at the same time and limit those artifacts and ghosting effects, and actually can make someone where they couldn't see with glasses or normal contact lenses to the point where they're actually seeing really well with scleral lenses. Now, if you are someone where you feel like maybe your glasses never seem to get to 20/20, they're never really that clear, you have astigmatism and those ghosting night effects, and you're kind of wondering, hey, I wonder if my astigmatism is irregular. What can I do about it, or how can I get it checked? Now, when you go in for your comprehensive eye exam and they update your prescription, there is one test that they usually will do, and that's an autorefraction. So they kind of get an automated measurement of your prescription. And one thing that it does do is it will measure the curvature of your cornea. Now, a lot of times this can catch, especially the most severe type of curves and astigmatism corneas, because it will show, hey, that curve is looking out of range and different from the others, but it won't necessarily tell you if you have irregular astigmatism. The other thing is when the doctor is trying to find your prescription, asking, hey, which one's better, 1 or 2, sometimes there are certain clues that give the doctors, hey, this isn't really working out. Maybe the astigmatism is kind of all over the map. This patient might be picking this number and then this number and then fluctuating a little bit. Sometimes that can give it away that, hey, maybe this cornea is not really working like a normal cornea. Really, the way to find out is to have a corneal topography. This is a special scan instrument that actually maps out the surface of the cornea. And unfortunately, not every doctor is going to do this. It's usually not part of a comprehensive exam. Sometimes doctors will include it in there, but usually doctors will perform this if they are either fitting certain contact lenses, or maybe they are getting a hint or a glimpse that, hey, something's not adding up, and I want to find out why this person isn't seeing as well as I want them to, and so they'll do extra tests, and the topography might be one of those tests. Another way that sometimes it's found is people will go in for a LASIK screening, and they'll perform a corneal topography or a specialized scan that actually measures the front surface and the back surface of the cornea, and sometimes they'll find the different irregular astigmatism or keratoconus in that scan or screener. And unfortunately, irregular astigmatism can be fairly common to slip under the radar during a comprehensive eye exam. And this can be for a couple different reasons. Number one, a lot of times their irregular astigmatism can be pretty mild to the point where, hey, they are being corrected to 20/20 with their glasses. They're K readings or their astigmatism curvature is in the normal range. Everything's looking good. We look at the cornea, and the cornea looks nice and clear, nice and smooth. Nothing really is screaming abnormalities to us here, and so it can slip under the radar. Number two, irregular astigmatism can creep in later in life. So if you are someone that is wondering, you can ask your doctor about it. You can say, hey, I'm having more ghosting effects. Is it possible to get a map or a topography done of my cornea? And if they have one, they can do it. It takes really no time at all to do the scan. Or if they can refer you out, maybe you can go to the place where they're going to do LASIK and have the scan done there if you're kind of curious. So it is an option that you can request to have done if you're curious about it. If you want to learn more about astigmatism and keratoconus and scleral lenses, I'll put my playlist in the description below so you can check that out. And I'll put some videos up here as well so you can look at those. And if you have any questions, I'll be in the comments to try and answer them as well. I hope this helped. Stay focused.